Hello everyone, this is Yasamana Saish and I'm going to talk about the effect of socioeconomic status on mental health readmission rate. This is an investigation in the Commonwealth of Massachusetts. In 2019, the United States had 51.5 million adults with mental illnesses, which is approximately 20.6% of adults' population. There are different types of mental illnesses that differ in their degree of severity and can be investigated individually. However, generally investigation of any mental illness or AMI, which encompasses all type of mental, behavioral, or emotional disorders, can expose the significant expenditure and debilitating impacts of AMI on people's life. The purpose of this study is to explore the relationship between health outcomes, such as hospital readmission and opioid-related overdose death, with socioeconomic factors in Massachusetts. Our research design is an exploratory quantitative research which uses secondary data. We have used several data resources. The independent variables on socioeconomic data were obtained from various resources, including surveys conducted by the U.S. Census Bureau, such as the American Community Service, crime report of Uniform Crime Reporting by FBI, and the opioid statistics by Massachusetts Department of Public Health. The dependent variables on psychiatric inpatients and readmissions are collected from Inpatient Psychiatric Facility Quality Reporting Program by Centers for Medicare and Medicaid Services. Our socioeconomic variables include education, labor force and employment, income, insurance, housing, crime, opioid-related overdose deaths. Due to the small sample size, Spearman rank correlation coefficient was used to determine the relationship between health outcomes and social determinants. And also principal component analysis, or PCA, was used to identify patterns as multivariate statistics based on the structure in data matrix. Among 40 counties in Massachusetts, 11 counties were analyzed. The readmission was significantly associated with education, employment, and crime. Based on the percentage of population, the county with a higher percent of higher educated people was statistically significantly associated with higher readmission. Similarly, the labor force was statistically significantly associated with higher readmission. However, crime was negatively associated with readmission. From other side, education, employment, and poverty were statistically significantly associated with opioid-related overdose deaths. Particularly in a county with a lower percentage of higher education, was statistically significantly associated with opioid-related overdose death, and the county with the high percent of employed was negatively associated with opioid-related overdose deaths. Our PCA results was that education and employment were positively and crime was negatively loaded for readmission. The readmission factor explains 50.7% of the total variance. Employment, insurance, and opioid-related death were significantly loaded, while a high percent of population with insurance coverage and higher opioid-related death were negatively loaded. The employment was positively loaded. The readmission factor explains 44.7% of total variance. And finally, here we are showing that a socioeconomic factor like education can positively correlate to readmission and negatively affects opioid-related overdose death. You can see the counties each. And for the conclusion, this study supported that education and employment were positively associated with readmission, and employment and insurance were significantly associated with opioid-related death. The current literature reported that socioeconomic factors are associated with mental disorders, with the higher prevalence of mental disorders evident in lower socioeconomic status compared to higher socioeconomic status groups. Although it might not be easy to address socioeconomic factors on health outcomes, education, employment, and health insurance could improve readmission and opioid-related death in long-term viewpoints. And finally, for future studies, we propose to perform this analysis nationwide due to our limitation in the size of our available data. Thank you very much for your attention. If there is any question, I'm here for you.